Hi everyone, my name is Suzanne Kuhn and I'll be guiding you through slides 13 through 18 of this portion of the Leadership and Management module in the ATI Live Review. I'm going to ask all of you to continue to participate. You've done a great job so far. So we are going to look at a series of slides as well as complete an activity. So you can use your cards, you can raise your hands, but we want you engaged and feeling confident that you'll be able to practice some test-taking strategies over the next few minutes here. So let's go ahead and get started. A nurse cares for a client with terminal lung cancer. Which action should be delegated to the assistive personnel, the AP? So this is a select all that apply, and what do you know about select all that applies? Well, first of all, there will be more than one response. We know that there will be not all of the responses included, and that there's no partial credit. Okay, so let's go ahead and take a look and let me know what you think is the correct responses here, or are the correct responses. Very good, 2 and 4. So 2 and 4 can be delegated. Now let's look at why these are correct and why 1, 3, and 5 are incorrect. So number 2, is it appropriate to have the AP ambulate the client? Absolutely, okay? So that is a very reasonable task to delegate. And number 4, how about collecting vital signs and pulse oxes? Absolutely, very good. Now there may be some additional direction from the nurse about what to report or some additional information, but standalone, collecting vital signs and ambulating the patient are very appropriate. Now let's take a look at 1, 3, and 5. So for number 1, we have a patient who has just received a poor diagnosis, okay? So we're gonna reserve number 1 for the RN who has training or education in therapeutic communication, who will be able to answer questions, who will be able to do additional assessing of this client. So that is a client who is better reserved for the RN to take, and certainly most appropriate. Number 3, demonstrate to the client the proper use of a bronchodilator inhaler. So the key word here is demonstrate, okay? So with this client, we have an individual who will be maybe returning a demonstration, who might be seeing this for the first time, who might have lots of questions to ask, okay? And last of all, obtaining a urine specimen from the client's indwelling bladder catheter. This is actually a sterile procedure, so the process of obtaining that urine out of the port and preparing it to send to the lab would be out of the realm of the AP because it is a sterile procedure. Now the AP could empty the bag, the Foley bag, absolutely, but not collect the urine specimen that is coming from that port. You guys did great. Let's move on. A nurse cares for a group of clients on a medical surgical unit. Which client should be delegated to the PN here, the practical nurse? Select all that apply. Another select all that apply, but you guys are doing great with those. Okay, the correct answer, very good, are 3 and 5. So we can delegate the client who has bronchitis and is receiving bronchodilator treatment. Now what might we know about this client? Okay. Well, one is they're likely stable. They may have done this bronchodilator treatment in the past. Okay, so there's no sense of urgency, high acuity with this particular client. So very appropriate for the PN, okay? And number 5, advanced regular diet 2 days post-op cholecystectomy. Okay, so this client, again, is very appropriate. This is a progression that we would expect to see, okay? No indication that the client is taking a downward turn. We would expect this diet to increase, and again, a very appropriate assignment. Now let's take a look at 1, 2, and 4. First of all, here is the key word here, newly diagnosed. So newly is very important in this scenario, okay? So with the newly diagnosed diabetes, what would we expect? They're gonna have questions, there may be teaching, demonstrations, there might be involving families, some therapeutic communication, so on and so forth, okay? Facial lacerations and subdural hematoma. Not just seeing subdural hematoma, we might expect that there's a potential for high acuity, there could be some instability, again, a good assignment for the nurse. An exacerbation of myasthenia gravis admitted 3 hours ago. So this client has an exacerbation. What do we know? What does that word mean? That's a worsening, okay? So something is going on with this patient. It could be an airway, whatever it is, it's an exacerbation. They've just been admitted. There's probably a lot of areas for assessing, interacting with the family, developing that plan of care, so on and so forth. Okay, you guys are doing great. Let's move on to scope of practice. And anytime, remember, anytime you see these page numbers, that these include activities in your book that you want to take advantage of when it's quiet, if we don't do them here in class, because they are great ways to review this content. So let's see. We want to know what the AP tasks that are appropriate for the AP are. What do you think? Excellent, very good. Activities of daily living, vital signs, getting weight, INO, and promoting patient safety in a safe environment. Very good. What about the LPN, or the PN rather? Very good, excellent. So we're going to delegate clients who are stable. They can collect data, record data, report data, and reinforce teaching. And this is important, and this is how those decisions on delegation are made, okay? Is it a new teaching, or is it teaching that needs a little bit of follow-up? And last of all, for the RN, guys, you're doing great. Very good. The client who is unstable, I always like to think, unpredictable, instability, the client that needs assessing or assessed, teaching, developing a plan of care, okay? So we want to keep all of these in mind. And there's an activity in your book on page 13 that will help reinforce this, okay? All right, let's do a few more questions here. A nurse assigns 4 clients to the PN. Which findings should the PN immediately report to the nurse? Very good. Number 2, okay? Now, here's what's important about number 2. We had a client who had a regular heart rate of 88, and now it's irregular and it's elevated. So we want to report that fast. We want to, this is not one to wait and see. We want to report that. We want the nurse to assess, see if there is anything going on with that client that needs to be reported or addressed, okay? This is a change in status, very, very, very important. Number 1, the patient who has a rash in his left groin. The key here is that this is long-term antibiotics. So we would have expected to see anything that could be life-threatening or create some instability early on, okay? Maybe soon after that IV was initiated, and likely on the torso, we would have seen that, okay? Important, but not urgent. Number 3, the client with a recent diagnosis of terminal cancer who doesn't want to participate in care. We may expect to see this. This is not urgent. It's unfortunate, but not urgent. And we are going to address this patient, engage in some therapeutic communication, maybe make referrals, but this is not immediate. And last of all, 8 hours post-laparoscopic. That's having pain in their shoulder. Well, we expect to see that, right? They've had some gas put into their abdomen to inflate their abdomen, and so it's not uncommon as that gas rises for them to the clients to have pain. So we're going to get them up, get them moving around if we can, if not, moving around in bed. And as that gas begins to dissipate, the pain will too. You guys are doing a great job. Keep it up here. A nurse plans to administer the following medications. Which medication should the nurse administer first? Very good. Number 1, a scheduled IV antibiotic for a client with resolving pneumonia. So we want to keep those blood levels, those therapeutic blood levels of this antibiotic up in a therapeutic range. So consistently hanging that on time is important. And think about this, for the client who's resolving, what we don't want is a decline, because if we think about pneumonia, then we've got a potential airway issue, okay? Now, no doubt pain medication is important, but this is a 4 to 5 on a 1 to 10 scale. So we are going to medicate, not life-threatening. 2, this is 1 diarrheal stool in 1 hour. Yes, it needs to be addressed with antidiarrheals, but there's nothing here that's going to indicate anything that this client is unstable. They could be recovering from dehydration, or not dehydration, from some type of gastric event. We might be concerned about fluid and electrolytes. We might be concerned if they have ongoing diarrhea that they could become dehydrated, but there's nothing in this response or this option that leads us to that. So 1 hour, we'll address it. And last of all, the antipyretic. So when do we get concerned about temperatures? Red flags, 104 typically. So while 100.7, it looks like they have an order for an antipyretic. Again, nothing that's life-threatening or anything that would take precedence over getting that antibiotic home. And last of all, after receiving morning report on an adult medical unit, which client should the nurse plan to assess first? What do you think? Now think about your what the story is here, and think about what your, any key words that might help with this, okay? What are your options? Now we want you to pick. Not only pick, but stick. Pick and stick, okay? Right, so the correct answer is a client with acute glomerular nephritis. Now think about this. What is normal urine output in an hour? Normal or greater than 30 cc, 30 mLs an hour, right? So this client clearly has less than that. And one of the things that we would be concerned about is that this client has acute glomerular nephritis, which can lead to acute renal failure. So we want to address this early. So if something is becoming progressively worse, that we can address it, assess and address early, okay? So this is very important. Now, what about number 2, the client with the bubbling chest tube? We would expect to see that. We'd be concerned if this said that it wasn't bubbling. Okay, now that might be then the first option, but this says it's bubbling, and we know that that's a good thing, right? Number 3, the client 3 days post-op for a left mastectomy who is tearful and withdrawn. Right, and that's not an uncommon finding. So while we are going to address this client, absolutely, this does not need to be the first client, okay? Again, nothing that has a potential at this particular moment to become life-threatening or need substantial assessment. And number 4, the client with a wound infected with MRSA who wants to leave against medical advice. Well, sure, we want to hopefully convince this patient to stay and receive the treatment that they need. But again, we want to get up here and look at this client who clearly is demonstrating or has evidence that their output is less than what would be expected. Okay, you guys have done a fantastic job. Great participation. Thank you.